Hi, my name is Mike Verplanke. I'm a physical therapist at Freedom Physical Therapy Services in Grafton, Wisconsin. Today I'd like to talk to you a little bit about some of our treatments for our patients who suffer from temporomandibular issues, or TMD. Before we get into discussing some of those treatments, I do think it's important to identify people in the area who have more training dealing with temporomandibular issues. Personally, I do have a certification to treat the head, neck, and jaw, which is the Craniofacial Certification through the University of St. Augustine in St. Augustine, Florida. Currently, there are only approximately 40 physical therapists in the United States that have this certification. And I know of, I believe, only 2 here in the state of Wisconsin. Michael Karaginas, who's the owner of Freedom Physical Therapy and is located at our Fox Point office, and myself. Having higher level training in treating TMJ or TMJ issues is very important. Not just because we need to be able to treat the jaw, but also to be able to evaluate and treat the neck, as the two tend to go hand in hand. There is a high level of correlation between jaw issues and neck problems and vice versa. This certification, the Craniofacial Certification, has allowed us to effectively formulate a successful evaluation and treatment plan for treating TMJ issues as well as neck problems and the ways that they can basically affect each other. After we've done an evaluation, some of the treatments that we will do tend to overlap if the patient has a joint problem, a disc problem, or a muscle problem. We tend to start externally and then kind of work ourselves internally inside the mouth, intraorally. To begin with, again, sometimes as we're dealing with patients who have temporomandibular issues, it's a very sensitive area. People come to physical therapists not really knowing that we are going to be doing intraoral work, so it can be a little startling for patients at first. So starting externally is a nice way to get them used to our touch and some of the treatments that we're going to be doing. So externally, what we're going to be assessing is the temporalis muscle and the masseter muscle. We can also go in the submandibular area into the digastrics and some of the anterior neck muscles. But for this video, we're going to start with just these two, the temporalis and the masseter. We will be doing firm, broad hand placement. If we're too fingertippy, it can be a little bit more tender and more discomfort for the patient. But we're just assessing for muscular tightness, any trigger points, soft tissue restrictions, asking the patient, if there's any, tenderness, pain areas, if it's recreating any of their localized pain or even any referred pain, to let us know. Oftentimes these can be big headache generators for some patients. And it does feel like there's a little bit of tightness in through here. Would you agree?
Yes.
Yeah. So we can spend some time working through this area externally, doing some soft tissue work. We can also do something called intramuscular dry needling, which can be a very effective tool to help release some of these restrictions. After that, we can go down into the masseter. Same principles, using broad fingers, broad finger contact, as we don't want to be too pointy with our fingers because that can be really tender in some of our patients. But same principles, we're just trying to feel how the muscle tension is, if there's any soft tissue restrictions, if there's any trigger points, if it's causing reproduction of either her local symptoms or if it's causing any referred symptoms into teeth, into her head. There's a little bit of tightness in through here as well on both sides. But again, we can work through externally, work through some of these muscles and try to increase blood flow and help with some muscle relaxation. The best way to get at it though is internally, intraorally. With that, again, same principle, broad hand placement and finger contact so that we're not pinching and causing like a fish hook. We don't want to irritate the patient and the muscles. So typically we'll, again, forewarn the patient that we are going to be doing some intraoral work. That way they're not too taken back by us doing some of this. So I'm going to come in, I'm going to use my thumb on your cheek.
Okay.
If you have any problems, let me know. Go ahead, open. And relax. Go ahead and just relax. There we go. So on my thumb, I've got her cheek, and I'm kind of getting right into some of the masseter region, blocking the muscle insertion right here at the zygomatic arch, and just doing some strumming through the muscle right in through here. So it's a little bit of a stretch. We can also do some massage, some cross-friction massage, a little bit of pulling in through the medial pharyngeal constrictor and the buccinator raphe right here, some of the other facial musculature, just to help with relaxation, increasing blood flow. Is that okay?
Yes.
Go ahead, open. And relax. So again, initially, we start nice and easy. Want to make sure that the patients are comfortable with what we're doing. We don't want to get too aggressive too soon. But there are times where we need to go a little firmer, a little more aggressive with some of the muscle work. But again, we typically won't do that initially as we're trying to get a good assessment of the muscle and see how the patient tolerates. How are we doing? Good, right? Okay. There's other intraoral muscle work that we can do. We can get at the temporalis insertion on the coronoid process of the mandible. We can also get into the medial pterygoid. We can go sublingually under the tongue to hit the digastrics. But again, for the purpose of this video, I think I want to kind of keep it to some of the larger muscles that you guys are going to be able to see. So go ahead and open. Go ahead and lift your tongue. But we can come in, go ahead and relax, under the tongue and kind of work through some of the digastric muscles and through this area. So between my fingers, we have those muscles in through here. A little harder to see on the video, I'm sure. But after we've done some of the muscle work, we typically will do some joint mobilization techniques. Again, this isn't just something that we will do for everybody. We want to make sure that we have the right treatment plan for each patient. Some patients might need more muscle work versus joint work, and vice versa. But again, a thorough evaluation will help us identify which areas we need to focus on. When it comes to some of the joint mobilizations, the basic one that we'll do, I will have my thumb on her bottom teeth. She'll relax, and all I'm doing is just a little bit of a joint distraction. I will show you actually right through here. So I will have my thumb on her teeth, and I'm pulling the joint downward like so. Obviously it won't move that much, but we're just trying to give a little bit of a joint distraction to help with joint mobility and lubrication of the joint, and if there's any joint inflammation. Okay, go ahead and open. I'm just going to rest my thumb right there. Bite gently for me, and relax. Go ahead and just let go. There we go. So it's important that the patient try to relax as best as possible. It's going to be very challenging to see. That's why I have my finger right here over the joint so that I can feel the joint moving under my finger. And so the motion is, my thumb is right here, and it's just this motion right there. Again, not that much, but that is the motion that we're going at. And I'm trying to distract the joint right here, or just pull it away from the joint surface. Go ahead and open, bite, and relax. So the joint is right here, and we're just pulling downward very gently. This isn't a hard or aggressive motion. Whenever we're dealing with the jaw, we're talking about millimeters of motion. So not a lot, much different than a knee or a hip or a shoulder. This is just a very small motion. So we want to approach this with finesse. Any problems with that?
No.
Okay. The second mobilization that we can do, instead of my thumb resting right on top, we actually move the thumb to the inside of the teeth, or lingually, towards the tongue. And the motion is this way. So we're actually, if the joint is right here, it's a lateral or to the outside motion of the jaw or of the joint. So we'll look like this. I'm going to bring my thumb on the inside. Go ahead and relax. Joint is right here, and it's that motion right there. Not sure if you'll be able to see it in the video. But again, my thumb's on the inside of the teeth, and we're going that way. So we're trying to bring the joint laterally. So it's a lateral glide of the condyle, and we're gapping the medial joint, the inside of the joint. Okay, I'll show you one more time. Bring my thumb on the inside. Go ahead and relax. And we're mobilizing laterally. Same principle, we're dealing with millimeters of motion. Nice and comfortable. Shouldn't be painful. Wasn't too bad, right?
No.
Okay. The third one that I'd like to talk about today is where we're actually moving the cranium, or the head, over a fixed condyle. So if my fist, both gloves here, the condyle, when I refer to the condyle, we're referring to this part of the jawbone. So if my fist is the condyle and my hand is the cranium, or the head bone right here, what I'm doing is actually taking the cranium and moving it to the side so that the condyle is actually moving medially, or towards the inside. So we're going to be taking her head, or her cranium, and doing a lateral glide of the cranium to create a medial glide of the condyle. So this technique will actually look like this. Go ahead and open for me. Bite of my thumb and just hold right there. So having my thumb between her incisors helps to gap the joint a little bit. And I'm just going to block her condyle. Go ahead and relax your jaw. I'm blocking the condyle, and I'm going to be taking her head and gliding it medially. So the force is not through this hand. This is just stabilizing here. The motion occurs at the top hand, where I'm bringing her head laterally so that the condyle actually glides medially. That was okay?
Mm-hmm.
Let's show you one more time. Bite and hold. And relax. So we're taking the cranium, gliding laterally over the condyle to assist with medial condylar glide. This also helps to treat the superior joint space, which we didn't discuss too much here. But the first two, the distraction and the lateral glide, help to address the inferior joint space, which is usually the space between the disc and the condyle. Here's the disc. That last mobilization helps to deal with the superior space, which is between the disc and the eminence, the superior joint. From those three basic joint mobilizations, we can then get creative. We can help do an active assist, so we'll have the patient open while we're doing some mobilizations. We can have the patient protrude or jut their jaw forward. We can have the patient extend their head while we're doing some mobilizations. So we can definitely branch off from those three basic mobilization techniques. But really those three are kind of the bread and butter of what we're doing when we're dealing with mobilizing a restricted joint. And again, from a muscle standpoint, externally, temporalis, masseter. We will get into the head and neck, and that might be for another video. But for right now, externally we're focusing here, and then also some of the other musculature sublingually and throughout. Should you have any questions, feel free to reach out to us at Freedom Physical Therapy. Again, my name is Mike Verplanke, and I hope you found this video interesting.